books, some of my favorite authors, and other things that just represent pieces of me. To the side, I have a bluish greenish guitar that I've been learning how to play. You don't want to hear me play it though. And then to the other side, I have a cardboard cutout of Okoye, who is one of the Wakanda warriors from the last movie that just came out in November. I'm holding on to Okoye as my admin support in my office today and most days. You may notice, am speaking a little bit slower. I do want to give you all a heads up that we have some wordy slides today, and I just wanted to be transparent about that. I also want to be transparent that as I am working to become better accessibility-wise, working with these amazing interpreters and CART people in the background, our imaginary, what I call our magic hands and minds in the background, that this is a process, and that we're learning and growing. We are all wise. And so as I take time to make sure I'm enunciating and not leaving behind interpreters or folks who need more time just to read and process, it will be a little bit more time consuming than probably normal. And that's okay. Well, what is normal, right? And interestingly enough, we're talking about power, and power has something to do with who gets to decide what's normal, what's of the norm, and what's not. A little tidbit to preface our conversation today. Thank you, Serena, for the links that you will be dropping in the background as well. I will share some things that you may want to learn more about, because this 90 minutes is just not enough, but it is enough to build some capacity for the work that we must do outside of these sessions. I am going to share my screen now, and I'm going to start with the very first slide, which is a slide I have been bringing in. Actually, no, I'm at the end. Let's go to the beginning of our conversation today. And that's why we have grace. So on our first slide today, I've been bringing in this slide for every single session. This is the fourth session of Shift Your Power. This is the third of the actual power content. Our first session was called the Series Success Session, and was really about grounding us in definitions and language we'd be using for these 3 sessions. So this is the final of Shift Your Power. On the screen right now, to the left, we have the words honesty, humility, humanity, healing, and hope. Those are words that I carry with me in every space and place for the equity and justice work that I do every day. At the top of the screen, there is an icon that represents head, with a brain in it to represent intellectual data and knowledge. At the top, there is also a heart icon to represent emotions, which are part of our shared humanity, and we must feel to heal. And then lastly, hands are at the top. A lot of H words today for collective care and action. And as a reminder, action looks different for us depending on who we are and how we show up. So we can define what action means to us as a community, as an individual, as public health. And this is the work that we're doing in these sessions of building capacity to be able to do that. Invitations that I extend to you all today, as I have for the last 3 sessions, have been to notice your feelings and tensions, sit in any discomfort you may have, and explore why you feel this way. And of course, take care of yourself. I often say that our emotions are information, and that discomfort leads to discovery. So where you are feeling challenged, there may be something you want to learn more about. And speaking of learning more, take note of things that you want to learn more about, because this is a small part of the journey. Learning and unlearning is a process. Continue to be critical, continue to ask why. Exploration is education. What we've been doing in these sessions have been a lot of exploration. Exploring power historically, when we talk about our analysis and our origin stories, talking about, we were exploring how power shows up in our organizations. And although there's social, political, and economic power, there's power in people, which was our last session. And then today, power on purpose. How are we shifting power intentionally to be transformational? Before we move on, I have one last invitation and request, is that we lace this space with grace. grace for humanity, grace for technology. We are imperfect as human beings, and that's okay. So hopefully we can hold on to that grace, because you never know what might happen, you all, especially with technology these days. So today's session and the last session of this series is called Power on Purpose: Strategies for Engaging Community Leadership with Intention. Public health is very, very knowledgeable on community engagement. But what we're talking about in these sessions and in this series is beyond engagement, and it's about power, balancing the power scales. So what's important when we go through this session is to think about how we're modeling power sharing and centering those who are most impacted within the system's change process. If you take nothing else away from this session, we should be centering those most impacted. They are the experts, they are the leaders, regardless of degrees, formal education, or titles, senior titles, or not, okay? So I wanna put that out there, because we're not just talking about communities outside of our walls, but also our institutions, our communities. Adopt a power sharing approach where systems actors share their dominant role, positionality, or component of the system, often relinquishing control and authority. So our role as public health practitioners is to use our power to support those who have historically and traditionally have less power. Take a more mutual and interdependent approach in opening up opportunities for those with less leverage and power to step into greater ownership and responsibility. Again, we are not the experts on communities' conditions. The people that live there are. Change who is at the table to directly address racial inequities and other forms of oppression. Integrate a power sharing model for forging long-term relationships with community power building organizations and or leaders. So it may not be a formal organization. It may be a group of mothers who are taking care of the community kids. And these folks are who often represent and are made up of people and communities most impacted by their inequities. Whichever inequities we are talking about, whoever is the most impacted by them should be the ones leading and informing from beginning through and to the end. This is a process with no end and no set arrival point. It is a constant state of change. It adapts to new information, and that gains wisdom and insight from dynamic conditions and perspectives, because power is dynamic and relational, and it is always changing depending on the purpose. I want to note that I see a mistake at the top of this slide, that the word process is missing an S. And it's really unnerving to me, because I'm a perfectionist, and I just wanted to be transparent about that. I saw it and it's making me anxious, but it's okay, because we make mistakes as humans. And so I made a spelling error. So as we're talking about power and moving into this next slide with Martin Luther King Jr. on it, he has his fist up in the air and it looks like he's talking to a crowd. He says that power, properly understood, is the ability to achieve a purpose. Whether or not it is good or bad depends upon the purpose. And this is what we use in our grounding session, because we really want to think about power as something that can change in spaces and places based on the social interpretation of how we look. What we do know, and what's well documented, and what has been shared throughout this series, is that power imbalances create and perpetuate all forms of oppression. Power relationships are unequal, and that's one of the primary reasons for the conditions and problems our communities face, not people's choices. So our traditional way in public health of blaming and shaming must shift to naming. So we're not blaming and shaming people for their choices. We are naming power for the ways in which it shows up and creates and perpetuates oppression. In order to sustainably change, and by sustainably, we mean the money's gone, but the improvements are still there. In order to do this sustainably, the conditions in our communities must be built by collective power. It must be led by those who are most impacted to create that long-term systemic change. How much grant funding have we gotten on health disparities? That's a rhetorical question, but I know how much I've gotten on my work. And I've been in public health for close to 25 years at this point. Those most impacted by the problems and conditions we seek to change should be leading and guiding the process from beginning to end, not coming in afterwards to review. Culturally created, not culturally competent. So we're going a little bit further, going a little bit deeper. A more systemic way of understanding power is essential. So thinking about all ways in which every system impacts the health and well-being of people and communities is important for adequate and intentional approaches that do not perpetuate harm. So we cannot be thinking in silos. We must think systemically. How is every system, sector, social determinant, or contribution to health impacting our health and well-being? Where we live, work, eat, play, and pray, etc. This is a slide that I have brought in with a framework, our framework for essential public health services. It is a diagram with multiple colors, has the word equity on the center in the middle. I will not read everything on this framework, but I bring this framework up to offer to us all that this is what we are accountable to. Public health responsibility is a framework that now centers equity. And viewing equity as a process and not just an outcome requires us to shift power. Shifting power for us as public health means that we are actively promoting policies, systems, and overall community conditions that enable optimal health for all, which is a human right, by the way. And who do we consider human? That have resulted in health inequities. All right. We're also seeking to remove systemic and structural barriers that have resulted in health inequity. So shifting power is an action that we are being accountable to. These barriers that we are addressing include racism, gender discrimination, poverty, ableism, ageism, fat phobia, homophobia, and other forms of oppression. And only then, when we address those things and shift and rebalance power, where everyone have a fair and just opportunity to achieve optimal health and well-being. So this is an emerging term in public health. We've been thinking about it as an outcome for as long as I can remember, but we really want to emerge into this idea of a process and a practice. When we think of process and practice of equity and operationalizing equity, it is asking, how is power showing up here? Who is being impacted and how? So I wanted to bring in this quote, "Nothing about us without us," which is from the disability justice movement. Do not quote me on this, but I think this was coined in the 80s, maybe 90s, but I'm thinking it's in the 80s. I'm going to invite Serena to actually drop a link. I just learned something new this morning. I'm learning something new every day. I love it. About the disability justice quote that is now shifted to "nothing without us." And if you stop and think about that, that's really powerful. But a lot of justice movements have adopted this quote to say, don't do things that will impact us without us having a word. We are the experts in our own condition. So nothing about us without us just means you should not be thinking you have the answers. Those closest to their pain and problems are also closest to their joy and solutions. And we cannot dictate what that looks like for anyone. So this is why community power matters. Now, first of all, what I know as someone who is personally an organizer, and I was a public health educator, so that tension that I always sat in, living in a community with the worst health disparities and not being able to advocate for those communities, that it is so important that nothing about us without us should literally be a 101 rule, that we should engage those most impacted early on and often. Early on and often. In fact, we should think about the impact first. Are people going to be better off? Health is influenced by community conditions where a person lives, learns, works, and plays, and they are the expert on those conditions. Low-income communities and communities of color and other historically oppressed communities have been excluded and still are. Research has shown that those most directly affected by systemic barriers and inequities are best positioned to drive change in their communities. Another thing that's well documented that we know in public health, that we share. I've been talking about community engagement from curriculum to community. So that is something we understand, but we're not necessarily practicing in a way that promotes impactful change. Now, Reverend Dr. William Barber, longtime leader of the Poor People's Campaign, says the relationships we develop with our partners must be transformative, not transactional. So we hear a lot about transformation. What does that really mean? What is transformative versus transactional? This slide has Reverend Dr. William Barber in a purple shirt. He has a purple robe around his, looks like his vest or a suit. And I chose pictures of all the people who are quoting with their hands in the air, speaking in a mic, because that's what they're always doing, is speaking. And these words that are quotes on this slide are also words that I hold in my heart and in the back of my mind whenever I'm doing my work. And this is so important. In fact, we are doing more than advancing equity. We are moving towards transformation. The slide that I just brought in is a slide that I brought in last week, you all, kind of at the end. And so I wanted to bring it in just to introduce that when we're thinking about transaction, which in this left-hand corner on the left-hand side, there's the word transaction with arrows going in opposite directions. And this is what I call performance. When we are checking of the box, when we say racism is a public health crisis, but we don't put anything into practice, any policies forward that show that we want to support the idea that racism is a public health crisis. So that is when we're performing, right? That's transactional. When we're pulling data from communities and never putting anything back out, performative. Looks like we're doing something, but what are we really doing? At the top right-hand corner is this square that says transformation. There's a lot of little moving, messy pieces and colors and things going around. It's supposed to be messy. You're not supposed to be able to read what's going on in that little square. And transformation is where practice is happening, not performance. We're not checking boxes. We're challenging the box. We're not even changing the box because we want to chuck the box. And practice is what promotes progress. So we're not trying to be perfect. So in this process of transformation, we must be humble, we must be human, and we must understand that it will be messy. But that's what happens when we're imperfect. And that transformation cannot happen without the vehicle of trust. So that car in the middle that says trust on the door cannot go without the wheels of truth and the gas of transparency. So what I am saying is that in order for us to move from transactional ways of being that are perpetuating power imbalance, we must build relationships on trust. And trust requires truth and transparency. And only then, when we get to that point, are we actually practicing towards progress, towards transformation that we all deserve. Transactional relationships focus on human doing, centering production, profit, power over people. It's detached professional communication, completing a transaction for efficiency or urgency, gotta hurry up, get it done, no matter how it impacts people. Reaching out and acknowledging folks only when you need something from them. That's transactional relationships, which leads to transactional goals. Transactional deliverables, which are ranked above meaningful engagement or qualitative goals. This is when we're focusing on the numbers instead of the narratives, the statistics instead of the stories. Rushing to achieve numbers and train more people versus building new and stronger partnerships. So when we think about transformation, transformational relationships are focusing on how we be. How are we being? Human being. Centering humanity, centering people, building relationships based on trust, understanding, shared values, and commitments. We all many times have the same goal, but have different gifts and wisdom to share to the process. In the simplest ways, transformational relationships is about taking the time to see, to greet, and to acknowledge each other, acknowledge our shared humanity, sustain caring human connections, and valuing all gifts and contributions, because public health work is the work of humanity. It is human work. And transformational goals, when we're being transformational in relationships, then is focused on meaningful engagement with depth and quality beyond the surface, and using qualitative goals or stories and narratives that have always been part of this equation, in addition to other deliverables being requested. So how do we start gauging how important relationships are? How do we measure those? How are they observable and measurable? And that's why I think it's difficult for us to shift from transaction to transformation. It's how we've always been. So we are here in the transactional space, but we are working to move in the right direction. So when we talk about transactional, y'all, I brought in this box of bureaucracy last week when we talked about the fact that we know that social, political, and economic power exists. That's what we talked about in Knowledge is Power. That's what we talked about when we talked about our origin story, the historical context around why we are where we are. And I brought in this box and I built it one side at a time. So one side, bringing it up to the left here, we've got funding. One wall, one side of the table, one side of the box, one side of the frame. Then we bring in this top line where it says policies, the other side of the table or box or frame. And then on the right, we bring in, we're going around counterclockwise. So we've got funding, policies, and time. Time brings up this other side of the wall, this third side of the wall, table, or frame. And then lastly, hierarchical power dynamics brings in the last fourth side. And then we have culture and norms in the middle, perfectionism, sense of urgency, quantity over quality. Progress is bigger and more and more and more production. Either or thinking, we have to make a choice between one or two things without understanding that two experiences can be happening at the same time. Both and is our friend. So either or thinking is binary thinking. It is very limiting, just like this box. Power hoarding. Got a lot of power. If you work in a public health institute, organization, any type of organization, you are a gatekeeper, you are a power broker. Even if you just say, oh, I'm just doing IT or I'm just admin staff, every single person who's employed by an institution is a gatekeeper or power broker. Paternalism, power over, we've got the answers. This is the hardest barrier for engaging community right here, but all of these, I think, make it difficult for us to do our work within institutions. But then we think about our community folks trying to come into the fold. Individualism is an American value and something that we uphold, whether we name it or not. And we just can't think we're going to make it forward towards transformation as individuals or as a public health discipline, because so many systems and sectors impact our health. And so when we think about this box of bureaucracy, and I brought it in last session, I invited everyone to just kind of reflect on where you've seen this, or if you've experienced the box of bureaucracy or barriers, and how does it show up in yourself, your institutions, and also how does it impact the communities outside of these four walls? So when we talk about transactional, this is the why. I mean, there's not a lot of room for transformation. There's not a lot of room to build relationships of trust here. There's a lot of pieces that we are tethered to: funding, policies, and time. And even the power dynamics in our organizations and how much time it takes for things to get approved. And all of these things can really cause a lot of barriers for the work of transformation. Now, I know I'm paying attention to the time, you all, and I want to make sure that I'm honoring time, even though I know it to be a construct. I've been talking slowly, but I hope that I haven't lost anyone and we're all trekking together. I see Walter over there. Thank you so much, Walter, for your support. I know that I've been talking fast, so thank you to the ASL interpreters who have been coming along with me on this journey. So as we think about thinking outside of the box, what I have on the screen right now are two pictures. On the left-hand side is a picture of, it says NACHO Exchange, and this is an article that was put out in the NACHO Exchange in the winter of 2021 around health equity. I read a lot of this stuff that comes out just to stay on top of things. On the right-hand side, there's a picture of hands. Well, actually, both pictures, all pictures on the screen right now are hands. One picture has two hands, palms facing forward, that says "Stop Racism." Then on the right-hand picture, where it says "Shifting and Sharing Power, Public Health's Charge in Building Community Power," are hands that looks like they're clapping together up in the air. And thinking about how I started out this session, sharing the icon of collective hands in action, I find this to be quite fitting. So when I say community power building organizations, I also want to name that I'm talking about leaders in communities. It could be mothers, it could be a cleanup group, it could be a healing group that's getting together, it could be actual activists working together to get some other kind of condition or improvement in the community. But our natural partners and leaders for public health are already doing this work and have been. Justice allies know what communities already need because they directly engage, build the leadership of, and are accountable to people in communities most impacted by inequities. Be clear that communities that have historically and traditionally been minoritized, marginalized, or left out have been working for their own solutions for a very long time. So that wisdom is so important. Also, community leaders bring vision and skills to challenge structural power imbalance. They already have the strategies and tools. They already know what they're doing, and they build power for sustainable change, which they have been upholding in their communities, again, for a long time, generationally even. They also have a structural understanding of what happened here. I talked about that in session number 1. We must engage community leaders to ask, what happened here? What is the story? What are we missing? Also, beyond the structural understanding, folks in community who are community leaders also have experience working to advance policy and systems change at all levels of the government because they've had to, because they've been forced to fend for their communities. And so they do. There's no one in these communities that have been left out that are sitting around waiting for some package to drop in their lap. And lastly, they bring experience around applying pressure and managing the power dynamics that are needed for making social change. A lot of times, you all, us as public health people, we cannot advocate if we wear a badge. That was something that I had to work around a lot of times working in a local health department where I worked in Durham, North Carolina. I had to build relationships with community leaders that could go to meetings on my behalf or the behalf of whatever initiative we were working on, because I knew that I would not be able to show up. But again, we bring our resources together. So I could support community leaders with funding and resources. I just couldn't be the voice, and nor should I have been. Okay, let's be clear. So I'm going to share 5 strategies and actions that are also in this article. Please feel free to check out more of that, more of this article beyond this session, but it's just 5 really simple strategies. Some of these you may be doing, some of them not. Maybe you're doing them well, maybe not. And so I'm bringing these in one at a time, and then I'm going to bring in our amazing panelists to share, because we've got some great community folks on this call. But first of all, you want to identify your local community power building organization that you want to connect with, or whoever those community leaders are. Seek out new relationships besides those you know. The first place I would invite people to check, if you work in a health department, check your frontline folks. Health educators are some of the, they are full of wisdom because they're on the front lines. They are literally in communities. So anyone on the front lines of your organizations are usually the closest to communities. Check and see what interventions or programs or projects are already happening. A lot of times we skip over that and we're recreating the wheel when literally you could learn lessons from what's already happening. Learn more about these groups, learn more about these leaders, do some research on their reports, their plans, what strategies they've been using, what is their social media presence like. Notice their priorities, their vision, their principles, commitments. Pay attention to who they're engaging or partnering with. And also thinking about where you align, but also where you could help mobilize these partnerships, because public health has that power. And we may not feel like we do, depending on your position or proximity to different leadership levels, but there's always power in people. I want us to remember that. You want to be flexible with number 3, flexible and persistent in communication, because community leaders often have very busy and evolving schedules. Please don't expect people to work at your 9 to 5 expectations, especially when people are working multiple jobs and trying to fight in their communities and work to pay their bills. Think about when you schedule meetings. This was something that I had to really challenge a community partnership I was working with really hard on, and say, hey, we're having meetings in the morning when people are at work. So how is their voice being included? We're literally leaving people out just by the times that our scheduled meetings are. In addition to the fact that we get paid as employees, and folks who are volunteering out of the community do not get paid to come to these meetings. So we really need to think about, are we community centered? Community led? What are we really doing with intention? Also, connecting via text or social media may be better than email. It may be better to reach out via DM or like some kind of message on social media than sending an email. But if you send an email, don't expect people to rush around and turn around through the sense of urgency and respond right away. Everyone does not adhere to the same structure of time. We all have different orientations to time, and time is cultural. So be mindful of that as well. Number 4, and then we have one more at 5 for strategies and actions to support community power building. You want to intentionally pursue activities together that build and deepen trust. I can't say the words trust enough. Trust is built. It doesn't just happen. And you have to do it by having conversations, by sharing your values. What are your goals? What are your principles? What is your mission? Where are the similarities? Where are the differences? Where are the gifts that every party holds, and how do we bring those together with synergy? And then being transparent about limitations and capacities. You may not have tons of funding. Be transparent about that at the beginning. If you don't have money to pay community leaders, you might want to be honest about what you're about to ask or do. And then showing willingness to commit, follow through, and receive feedback about the effects of your actions to improve collaboration. Again, understanding that those who are leading transformation should be those who are most impacted. And then lastly, you can start with small, concrete collaborations, such as, like short goals to help create small wins that build trust and support for longer term relationships. It may just be a one-on-one. It may be some kind of connection over coffee. Support a community, a Black or Brown owned or LGBTQI plus owned coffee shop. Think about how you're being intentional with supporting community assets and also building relationship. And how you're showing up in communities. Don't expect people to come to your table. That table is convoluted with anti-human practices. So this could include inviting leaders to your leaders or organizers to staff meetings, as long as you're intentional about how that's happening. And sharing any data, reports, or any information that you have as a public health organization that's relevant to their policy and their policy priorities. Again, as I said, our social determinants of health, our systems and sectors all impact our mental, physical, emotional, and spiritual health. So all of these things may be connected, whether you see that right out or not. And inviting organizers to provide input on your community health plans or reports. What is their view of what you're doing as a public health institute? Where is their voice? Where is their concerns? How are you sharing that back out? What action plans are you taking now that you've listened to community? So there's many different ways to engage, but you have to do it with intention, and you can't expect people to always come to you. I am going to stop sharing now. And I am going to invite, I'm trying to get all my stuff. Okay. I know that was a lot, but I'm going to invite our beautiful panelists. And sorry, this is Jana. I didn't say my name before I spoke. I apologize. I'm going to invite Stephanie and or whoever wants to come in first, Jordan, two amazing community folks that I admire deeply, to share or expound a little bit on what has come up for them through what I shared. Hi, Stephanie, I see you.
Hi, thanks, Jenna. Hi, I'm Stephanie. I am an Indigenous elder. I have my hair up today because I'm on the mountain time zone and I didn't have enough time to do my hair. I'm wearing a black blouse and I have silver dangling earrings that are Indigenous. And I so want to thank all of you for having me. This has just been an amazing opportunity. And I just want to kind of start with where Jana left off was I work with a number of groups, and recently I was working with the Denver Department of Public Health and Environment, and they have put together a community engagement toolkit that talks about how you operationalize community engagement. And it's similar to what Jana had said, but there's 4 steps that I really like. The first one is consult. And how do you consult with community? You conduct one-on-ones, you establish rapport, you have public comment periods, you have equitable surveying of your community. And every organization is at a different phase. And so then phase 2 goes to involve. This means listening sessions, this means focus groups, this means community conversations, storytelling. Storytelling is invaluable. And also conducting interactive workshops. And then the next one is collaborate. Establishing community advisory councils or panels. Signing memorandums of understanding with community organizations. Actual coalition building, and then community organizing. And then the last phase, which many organizations may strive or may not strive, but this is a very challenging last step, which is actually deferring to community, which is inviting them to be part of your budgeting, including them so you have funding. I get so tired of people saying, there's no money. But when you involve them in that budgeting and you put them there and they are part of that priority and you are going to compensate them for the work that they do, and then you hire them into your organizations. And so many organizations are really, how do you get to that, to the last phase of it? Last night, I actually worked with an organization that is working with elders called AgeWise Colorado. And I helped them to conduct a actually focus group listening session with elders from the Latino community. They're a rather new organization. They have not worked in the Latino community. And so they reached out to me. And one of the things that they talked about, which really troubled me, was volunteer. And we don't have any money. We can't pay people. And so I did a little bit of work for them pro bono. And I decided I'm willing to give this amount. And above that amount, if you want me at this table, then you find a way to compensate me. And one of the individuals who is a mentor of mine, who actually was at the table last night, she said, we are asking for fair, not free. And I think as we really move into valuing community, we must find ways to compensate them. And I have said this before many times. And the people who work for me in my small business, I never, ever ask them to come to the table for free. Nobody earns less than $50 an hour who comes to work for me. And there are times when it is higher when I have additional funding, but I will not ask people to come to my table without having money in a budget to compensate them. And to me, that is when we totally value community. Many, many times people have been asked for too many times to volunteer their time. And how many of them are volunteering? When I'm working with universities and I see that they have a budget of $500,000 and they tell me they have no money to compensate for these focus groups, I tell them I will not bring my people to the table. You must find a way. You schedule it when they're available. You provide food, you provide childcare, or you provide a stipend for them to pay for childcare. And you make sure that you compensate them one way or another. And so I think that as we continue to advocate for our communities and we want to bring them to the tables, these are things that we absolutely must do and not allow them to exploit the lived and living experience, the expertise, the formal education, the street education, everything that our community has to offer. So with that, I want to say thank you so much for having me. And I want to give someone else an opportunity to share their wisdom and knowledge. Thank you.
Thank you so much, Stephanie. It's always a gift. This is Jana speaking. I see the beautiful Andrea. I didn't see you, and now I do. And you have this beautiful green on. You have to come in. Would you like to speak, Andrea? I didn't want to call you in if. It's nice to see you. I see some things in the chat. Charlotte says, I found within our public health department the nuts and bolts of compensating folks with lived experiences an afterthought. The box of bureaucracy is so frustrating. Oh, I can't tell you how this is touching me so deeply as someone who worked in a health department for 12 years, and it was unnerving, Charlotte. Did you want to share some more on that? With your experience? No, okay. I wonder, I would also invite anyone who has had this. Is this a problem and why? And how do we address this within that box of bureaucracy if we know that box exists? Are there some loopholes we can find, y'all? Imani? Okay, come on in, Audrey.
Oh, yeah.
Come on.
So one, I look a little rough. I think when we're talking about like community input, right? I work at the largest trans-led, trans-focused policy group here in Texas, known as TENT, the Transgender Education Network of Texas, where we were in a state affairs Senate hearing, right, for over 12 hours yesterday. And they know absolutely nothing about trans people. And truly at this point in this country, when you are creating legislation or any policy against trans people, it is really for cruelty's sake, because the education and the outreach has been happening across all platforms from organizations, small and large, right, for you to understand who trans people are. And I think talking about public health, right, I can think about a time where I went to a meeting as a person representing my organization, and that public health department just came with every excuse in the book of why they couldn't do things with community, for community. And I think when you're going into a space and you're asking people for their time and their effort, and you don't have money to give, right, that you at least know things about them to say, I know this is a shortcoming of ours, but we are trying, and we are wanting to uplift you, right? In this meeting, they weren't aware that like trans people have a national testing day for HIV and AIDS, right? Like they didn't know, how much trans people are erased when talking about testing and being misgendered in reporting, and how we can look at state departments and say, well, in the state of Colorado, they're properly reporting trans people. Why can't we do that in the state of Texas? And so, having, I think, misinformation, and I'm sorry, there's a train behind me, is hurtful. And I think, to what my fellow panelist was saying of like paying people for their time, even saying, again, people aren't looking for the big bucks, but they're looking for, I want you to know that I appreciate you. I think about the great Monica Roberts, who was a extraordinary Black trans woman, an elder of ours who passed away a couple of years ago. And now I look at national organizations and large, groups of people who are saying what Monica would believe or wouldn't believe and what she would endorse or wouldn't endorse. And yet these people still are the people who would not pay for her travel, would not pay for her lodging, who this woman died in poverty because they wanted to use her name before paying her. And ultimately, right, that is where we are. When we look at the historical case of how gay men were finally able to be in relationship and not be just sexualized, the Black man in that case, and I will put his name in the chat when I think about it, he also died in poverty. His white partner who reported him for that inappropriate relationship, quote unquote, because again, it came down to racial inequality, he was a hero in this case. He was remembered. And so I think, again, when you're talking about what is your power in your department or in your role, understanding that all of these outside factors are affecting the people that you are trying to bring in, and how are you doing your part? Again, maybe you're not the person setting the budget. You're not the person who is, understanding where all the money goes, but having people know that you are believing in them, you have bought into them yourself, right? Of saying like, here's the reality of where we are. People just don't want to be lied to, period. They want to know the truth. They want to know what they're facing, because you also don't want to promise them something that you can't deliver on. That is, something that they're used to. But if you're honest with them and say, we really want to do this program, we really want to be inclusive of communities, we can offer X, Y, and Z to the best of our abilities, right? If that is gas cards, if that is childcare, if that is, a meal voucher or whatever that looks like, that all matters. Does it take a little bit of work on your part to ensure that those things happen? Yes, but the results that you are going to get, the product of your experiment or what you're trying to implement, is going to be so much better because you are enriching into their community. You're not just calling them every time that you need a favor or you need this report to be done or survey to be taken. They know that you are invested in them just as much as they're invested in you. And I think about that too. Literally yesterday, we had people who were dropping cards who went through like 30 minutes of traffic, but it's because Tent and Equality Texas here in the state of Texas are constantly checking in on those people. How are you feeling? How are you doing taking this news? How is it, on your soul, on your heart, that like this is what's happening in the state? And also knowing we're doing everything we can to stop this bad legislation or do these bad things. And those same conversations can be had, right? Hey, we haven't chatted in a while. I just want to check in. Feel free to come on down. Let's have a chat. Or I can go and meet you in your neighborhood, in your space, and say, this is where we're at with these things. This is how we want you to come in. But again, building that community so that it's not just transactional, as was discussed by Jana here, is so, so crucial. And at the end of the day, you get better results. Yes, this shouldn't be transactional, but also too, we're all here to do a job, right? We all know that. Even like community members who are volunteering their time know that. And so how can we get the best results possible? And that's investing in each other as people, not as a product, not as something that you can get out of somebody else. And so I just wanted to like throw that in there. But again, so thankful to be a part of this team and be a panelist here.
Thank you so much. Not a product, but as people. Jordan. Come
Hey,
on.
folks. Hey, folks.
Hey, Jordan.
Ah, Good morning. Good morning. Yeah, my name's Jordan. I use he, him pronouns. I'm wearing a gray buttoned up, that's unbuttoned shirt with a gray t-shirt that says Black Radical Healing Pathways with a shield. And inside the shield are 4 words of courage, wisdom, love, and service. I am a Black person, brown skin, glasses, and a nice little messy bun right now. So, we out here. Uh, and yeah, what I wanted to bring into the space, I heard you, Jana, really talking about systems, and I love talking about systems. I love talking about institutions. That's why we're here, right? Like, we are part of institutions. We are part of these systems. And you put up that box, right? That box of bureaucracy. And I think when I see that and how this conversation, what I'm hearing is us talking to other institutions, us talking to other communities. And you brought in this piece of we are all gatekeepers, we are all power brokers. And I just want to say, if our first step is to go talk to a community without acknowledging that we are a part of community and that we are humans ourselves, harm is going to happen. Actually, most likely harm is going to happen if we are working in the State Department, right? Plain and simple. So when I see this, I think part of the work that I really want to acknowledge is in our state departments, in our public health spaces, where are we doing the internal work, right? Like, where can we say, hey, for 2 hours this week, our whole staff center is going to talk about anti-racism, what we can do to unpack that ourselves individually. So when we go talk to, quote unquote, a community group, we can maybe have some language ourselves to talk about, right? And I say this really intentionally because I think what I'm hearing these days is this like coded language of community being them and not us. And there's something just unnerving about that, right? Like, even how we talk about, like, let's go talk to community. And like, I've always seen myself being in community, being a part of a group, whether it's my family, whether it's my job, whether it's, the after work program, maybe it's just the group I'm getting some food with, right? But like, I know I'm in community. So we have to like really get inside ourselves and inside how do we interact in those group dynamics ourselves, right? Because if we just jump into let's go talk to another group that we know has been marginalized, harmed because of our State Department, because of our United States government, because of X, Y, Z, we're most likely just going to reinforce some of those boxes of bureaucracy because we have not spent the dedicated time to unpack those things. So I would just say, like, in your states, in your spaces, find who is leading your anti-racism space for internal work, right? Who is doing your anti-transphobic space? Like, how can you do and lead in equity internal so then when you go outside you can talk, you can be in community, right? It doesn't feel so unpracticed or like we don't know what to do, right? Let's get back to doing some of those things.
Ooh, well, this is Jana again. Jordan, thank you. Okay, you said some real things here. I agree. I put in the chat box, me, we, us, because I remember living in the community that had the worst disparities, and it was like, it was never us and them. It was me, we, and us. And so when I think about that, I think about the individual, knowledge, love, deepen relationship with self. We are socialized outside of ourselves. I think of how that has opened me up to we and building relationships. And then outside of our organizations, it's us. It's not us and them. So that's kind of my approach, is how I think about change and how my transformation has happened, is that it had to happen for me first. And you're right, Jordan. These 90-minute connections is just not enough. There is a lot of work that needs to be happening, and it could be happening at the same time. And I want to thank y'all for sharing, because all of you all, I admire the words and wisdom that you always bring. And I'm really sitting with this whole Well, first of all, neuroscience tells us that we come into the world wired to connect to others. And this is something I'm just now like learning about, is that neuroscience, because I'm just now getting into neuroscience. And it sits with me around our shared liberation. That we know we don't need allies, because guess what? We're all in this together. So we don't need allies, we need co-liberation. So as we are shifting language and understanding equity as a process and practice, and we're thinking about nothing without us, period, right? And we're shifting into this space of owning our own power in people, that we must think about the fact that if I don't know me, I don't know you. And if I don't know you, I can't know we. And if we don't know we can't move forward. Relationships equal results. Relationships are where the trust is built. Relationship is where the transformation happens, okay? And Jordan, when I hear all of y'all talk, I hear so much of this, your personal passion and knowledge, right? And I think about how we're often told to leave our personal at the door, right, in our organizations. But the truth is that personal is where the power is. And while we are taught to leave our personal and our emotions at the door, we might want to ask why that is. And right now what's coming up for me is the box. But again, a lot to think about here, because here's the thing about anti-racist and anti-oppressive practices. They require us to shift power. Becoming anti-racist means you are consistently and constantly recognizing and redistributing power. That's what anti-racism is. And that's what equity as a process is. Connections. Now, I don't know if that connected for everyone, but I did want to be transparent in saying that as an anti-racist trainer, I have to say that anti-racist practice means shifting power, reevaluating, redistributing, reimagining power. I also wanted to, I see here, Charlotte, I just couldn't leave this comment alone because you brought up paying folks. And I know that was something that Stephanie brought in. I know that's something that everyone, it's always been an issue for me. I feel like it's been one of my biggest issues, and finding loopholes has also been one of my favorite games. I would love to hear if anyone has found loopholes. Now, I will say one thing that I've done, Charlotte, is because I understand that box and how things get done and how they were getting done in my organization, what I ended up doing, one of the issues that I had, I'll share my example, was that I was trying to hire Black and brown caterers, LGBTQIA plus caterers, people who I know their businesses were underutilized. And when we say underutilized businesses, we don't often put why they're underutilized, right? But I knew that this existed in Durham, North Carolina, because I would look up who we were hiring, who we were often asking to cater for us. And it was wild to me, the amount of insurance that caterers needed. And one thing that once I saw, there was a couple of policies that when I started understanding that this was about power, I would look at our policies and I would say, how is power showing up? Who's being impacted and how? That policy is perpetuating inequity. So what we did as a loophole was we would do like a memo of understanding or some kind of agreement with a community organization that we may have already been working with on something else, but we would do like this finessing or finagling, right? Where we would be general with what we were bringing them in on. And again, this is why thinking about this at the forefront is important, because you just can't stuff the blueberries in the muffin after it's baked. I mean, you could, but just not a good practice, I would say. And so really thinking about that and trying different things until we figured out how to make it work. Now, I don't know what kind of institution you're working from. I was at a health department. We were able to work through a community collaboration to pair up with a community group that could pay the caterer. Now, as Andrea says, it takes more time. And that's why we struggle in our institutions to be more equitable, because being equitable takes time. Absolutely. If we just go as we've been going, we end up perpetuating inequities because we're not slowing down to see who's being impacted and imagining other ways of being with this existing structure, knowing that we can't change overnight. Where are the loopholes? Stephanie, come on, I know you're gonna bring it.
Absolutely. Yeah. And what I wanted to say is that that has been an extreme challenge and it is real. We know that. But I have seen things changing over the last few years. And one of the things, and not necessarily a loophole, but something that has been really successful for me is that with my working community, I see people who are in these departments, especially departments of public health. And when they see the work that we're doing, I've had them reach out to me and say, we found some money in the budget. Would you be willing to help with this? So I've identified people, not necessarily the entire bureaucracy, but individuals in different components, sections, departments that are wanting to do this work. And so they then take that forward to the powers that be, and they find some money. I just yesterday, I got a contract with the Boulder Department of Public Health and Environment. And I had met this woman at a conference, as a matter of fact, where Jenna was the keynote speaker. And so it's taken 6 months to do this, but we finally have found a way to do it. I work now with the Denver Department of Public Health and Environment, and I met a woman on a community panel that I was on, and she was willing to embrace that and take it to her powers that be. So we find ways from the outside in, but it's not easy. And I think we don't give up, which is the most important thing. And we continue to find those people that want to help. And then we utilize that internally. And when we can't, we move externally and we do things other ways. We find, like they said, somebody that will cover the meal, somebody that will cover this. I do that frequently at community groups that I'm with. I'll sponsor lunch. I'll sponsor their event. And I'm a very small business, but this is important to me. And as long as this work is important to us, we will continue to fight that struggle to make sure that it happens.
Yes, Stephanie, this is Jana. And I also think that modeling is so important because we don't know, we don't know. So if you are modeling how to show up and build relationship, you're modeling how to show up in a co-directorship where you're multiracial, multi-social identity. So you're building you're building across cultures, you're learning more about, you're getting more education, exploration as education, right? As you are modeling those things, other people start picking it up. And I think that's also a part of how we have to advance equity because we haven't done this before. We are imagining something new. We are right now in the imagination of others. We've inherited these systems. And now we're starting to say, this is not helping all of us. We are not, this is problematic. So how do we imagine new ways of being, human being versus just doing how we be, not just what we do? Imani, I saw you come. Oh,
yes, I will. Hi, everybody. Oh,
hey,
sorry.
Imani.
This was just to Charlotte's point. Something that was actually really helpful for us in the natural disaster responding was just being really clear about the why. What we need to happen has to happen, right? And and to Janice's point about how this is a long process, right? What we started doing was getting FEMA and leadership to document their opposition to us. And it got to a point where their leadership even started to say, and it was very, and I'll use some examples, but it was very clear, what I said about, if you're serious about operationalizing equity, your budget has to reflect that. Getting leadership to admit that that's not an alignment for them and documenting that over time goes a long way. Like I'm for the just shame game, right? We know what needs to happen. We know the people who should be at these tables. The communities know what they need, and it often gets lost in leadership. And so the options, they have two options when you have this approach, and just being like very blunt about funding, are either they cave and they go with what you say, or they double down. And the double down is a beautiful place for exploration because they even start to hear it as well. So it's not really a loophole, but it's just kind of like Socratic methoding, reverse psychology leadership. But I've seen it work. So hope that helps.
I also want to share, y'all, we did have an example of a case, but this was actually brought up last week, Charlotte, paying community members. And so I had brought in something to share this week because it was brought up last week, but this is an ongoing challenge. And what we have to do also is think about what is already existing and what can we leverage. With that being said, I want to share my screen one more time because I couldn't have planned any better for this. But there is, and this is something that you can use for leverage, or just use and look through the language and say, you know, what could I use from this? But this there's a new legislation. It's not super new. I mean, it's kind of new because I think I shared this last year in December. It was fairly new then. But Washington State now has legislation to have compensation for community members. And I just put this out here because I feel like it's important to see what's already happening. And even though things may look different across geography or political landscape, and there's all kinds of unique nuances depending on, you know, different communities and where people are situated, there's a lot to learn from legislation like this. And I just want to read this legislation out loud. I want to read it. And I have some some words that are highlighted or bolded, but this speaks a lot to the reason why we should be compensating community members. The legislature finds that equitable public policy discussion should include individuals directly impacted by that policy. In order to do so, the legislature supports removing barriers to that participation. I just want to remind us that removing barriers is also what we say we're going to do with the essential public health services that now center equity. So same language here in this legislation. We're removing barriers, which is about shifting power. The legislature finds that asking community members with lower financial means to volunteer their time and expertise, while state employees and representatives of advocacy organizations receive compensation from their respective agency or organization for their time and experience, ultimately hinders full and open public participation. As a result, the legislature finds that removing financial barriers for those individuals fosters increased access to government and enriches public policy discussions and decisions, ultimately leading to more equitable and sustainable, those two words again, sustainable policy outcomes. Now, what is in this that might possibly be able to be leveraged for something on a smaller scale? And so I did want to just share the intent was to simplify participation in government actions, discussions, and decision-making. We know that policies and legislation can be important for something to ground us or center us or to leverage for power. This is what Washington State says they're going to do. So how do we leverage this to make sure that it's happening? And how can we use this language to also advocate for community compensation in our respective places? Another intent is to recognize the value and expertise that people with lived experience contribute to state government work groups. But even when we're thinking about our public health interventions and everything I shared today, this is just another reason why we're asking for wisdom and leadership from those who know what they need. And these guidelines are a living document. So even if you wanted to look through these guidelines and see what kind of language you could leverage or what kind of things you could start to advocate for or pull a group together for, revisions of guidelines also occur in response to community feedback. So also these folks are involved in the loop, the feedback loop. And so with all the information, feedback, agency input, and emerging research, this doesn't stay static. This can be evolving over time. And so I did want to share that because that just gives me a little bit of hope when we're thinking about this ongoing issue of paying community leadership. What we put our money and time to is based on our priorities. So we don't have time and money for anything. And when we think about that box of bureaucracy and how we're tethered to policies and funding and time and power dynamics, who do we have to send this up to get cleared to come back down for the deadline, right? The word deadline. Let's use live lines. I don't want to be dead when I get to the line. So even that language, right, is perpetuating anti-human practices. Charlotte, come on in the room.
Thank you so much, everybody. That language, that verbiage that you just shared is gold. We are literally working with our Agency of Human Services on revamping our policy as it in regards to compensating community members. So holy shnikes, thank you so much. I just wanted to put a big thank you all for your wonderful, wonderful ideas. I think we are in the process, Vermont Department of Health, of relooking at our grant making. And I think some of the policies that were put into place in an attempt to be equitable are actually really harmful in terms of folks can't sole source, when we know there's a BIPOC led organization that is best fit to do this work, we have to actually put the RFP out for a lot, and the hoops to jump through, the bureaucratic hoops to jump through sometimes aren't feasible for a small, priority population led organization. And so we're really looking at how we might relook at our grant procedures. But anyways, thank you all so much.
Oh, thank you, Charlotte, for sharing that. And thank you for advocating. Imani just put, you're championing for your people and for the communities that are going to be impacted by what you're doing. Thank you. I also dropped the link to that language if you wanted to learn more about it and just to have that as a reference. I also wanted to go back a little bit in the chat box and share what Sabrina shared. It was really helpful. And I love that, like we have to really name that funders are part of this bureaucracy as well. And that sometimes we have stipulations that we can't necessarily work around. Sometimes we can be creative. Other times we may not be able to. What this also has me thinking about is, what can we leverage? What can we say, when we do the background information or we're trying to get some funding, what are we naming as barriers? What are we leveraging and saying, this is what we say we're going to do, and this is what the actions look like. This is what we say we're going to do. This is what the CDC says we're going to do. This is what it looks like in practice. This is what it looks like as action. So even going beyond the words and leveraging things like the Essential Public Health Services Framework, or leveraging, literal language from our federal government public health agencies, can be a way that we can talk to funders and share, like, we know that this is a stipulation. We also know that this is a barrier. Or how are we engaging conversations with even our funders to think beyond the surface, right? So thank you all for, Sabrina, thank you for dropping that in. You always drop some great wisdom and things that I think are easy for us to forget about, right? That are always happening in the background. And Meg shared here that budgeting for supports for people with this disability need to participate. Yes. Again, if you, nothing without us. Can we say that together? I want to say nothing without us, not even about us. But you make sure that you have people who have disabilities, folks who have been left out, who have been locked out, that they are at the forefront, through, and at the end of these conversations. Andrea, I see you. You want to come in?
Yeah, I just have one more thing to add. I think something that, Tent was a very poor org in 2017 and 2018, before we started to really up our funding. And we would tell people, right, it is so costly to be inclusive of people, but the results that you get are unimaginable, that you can't put a dollar amount on, right? But having money for interpreters, having money so that your documents also are in that same language that you're interpreting in, making sure that you follow people's allergies and transportation and so many other things, right? Making sure that your venue that you're using is on a bus line, all of these things that you think about, right? One, that's a lot of brain power. And two, again, it does cost money. I'm not going to lie about that. I know how much we put in our budget simply for interpretation. But that is where you get the buy-in from people, where you see that long-lasting community come together, right? And say, you've been riding with us and making sure that we're taken care of. We're going to show up for you too. And I just wanted to it's a common thing for people to say inclusivity doesn't cost a thing. That's not true. It's very costly, but it's, again, very beneficial for both sides of building that community, building that trust, seeing people for where they are and meeting them there instead of them having to meet you and bring you to their side, right? It's flipping that dynamic and saying, we're coming to you, we're wanting to learn from you, the experts, and here are the ways that we are going to see your value in what you're bringing to us, because we know that that is strenuous and it takes a lot of time and effort.
Thank you, Andrea. Yes. I'm basking in your words. Jordan, give us a word. Give us a word as we come on down.
I just want to add in on this conversation about cost. I hear cost, and I'm like, look, first, I think we can acknowledge we live in a capitalist system. So like there's that cost of money that we're thinking about. But the flip side is, to me, what is the cost if we don't lean into humanity? Like, we literally are losing our humanity if we say we're going to have meetings where people can't hear or talk to us because we can't communicate. There's some sort of death and cost there that I don't feel is ever appropriate. So yeah, I'll pay those hundreds of thousands of dollars to make sure people can come to the meetings. I don't got the bread, but I'll find somebody to pay that bread. But to me, the cost of my humanity, I don't feel like that's ever appropriate. And I always want to acknowledge that when we talk about cost, right? Like that's the opposite cost we are losing. We are losing our humanity if we don't do this.
Absolutely, Jordan. That is a great point. This is costing human lives. Also, I want to be mindful and say that we spend money on some interesting things in our organization. So, when we do our quality service initiatives and we do our personality test assessments, how much are we paying consultants for that? I'm going to tell you something. First of all, scarcity is a false narrative. Number one. And number two, as I already said, what we pay attention to grows. What we pay attention to is what we put money and time to. But yeah, I think, Jordan, it's costing us more than money. And there is a business case to racial equity. I hate bringing it in because of capitalism, but it is true. So this is affecting us and impacting us on multiple levels, small and large. And we just can't, we deserve better, all of us. I'm going to leave it at that because I could go many different routes. I want to invite, Sabrina, what did you leave? Okay, also several departments of health were sued due to not meeting civil rights requirements for ensuring disability inclusivity. That'll get people moving. Pay one way or another, Stephanie. Absolutely. And what would happen if we thought about this from the beginning? I'm going to say one more thing, y'all. My whole career, I have gotten grant funding off of Black and racial health disparities. And I often find myself wondering, what if all that money that went millions, because I work with Duke and UNC, just really lucky to be on a lot of projects. What would happen if people got that money straight into their hands in communities where they could build what they need with that money, instead of us spending money on programs, brochures, cooking classes, etc. I'm just going to put that out there. So how are we spending our money and how is that being impactful? I know we're coming down to the end. I did want to invite Serena or whoever's dropping our poll in. Thank you, because we don't want to forget that part. And also, you all, this is the last session of our series, Shift Your Power. And you all have trekked either with me or in and out throughout, from knowledge is power to powering people to power on purpose. And I appreciate the time that you all have given. Again, I often say time is a construct. It is also a gift, and we appreciate you being here today. I also want to thank my lovely ASL interpreters, the CART captioners. You all are amazing supports for us and helping us on our journey to be more accessible. Me, we, us. We come together. Our liberation is bound. Our well-being is bound. Thank you, Charlotte. Yes, this is our last session of the series. Y'all, I'm gonna tell you something. This is a little secret. If Sabrina drops something in the chat, you want to click on it. I have like tons of tabs every time. So click on this, because Sabrina always drops really good wisdom and information and education. I'm going to add another tab to my fantabulous screen over here. I got 3 open right now. I'm so excited from this session alone that I'm going to dive into more. Is there anything that any of you all would like to come in and share? Imani, Serena, or anyone else? Here's our space. No, yes. I have no problem releasing us a few minutes early. I like to give the gift of time when I can. All right. Well, if all hearts and minds are clear, thank you all so much for coming. We appreciate you. Resist and rock on. Go shift your power. Thank you, JX. We appreciate you so much, always. Thank you all. Panelists, love you. So much love for you. Thank you, Emily. Thank you all. Sending love and light. Let's be human at work today. Use the bathroom, eat, take a break. Let's be human. Thank you, Meg.